In rescue situations, human life is always a firefighter's first responsibility. But once human life is safe and property is secure, you may have the opportunity to save an injured pet. To many of the people we serve, a pet is a loved member of their family. Their survival can make all the difference to those recovering from a disaster. This video demonstrates how to respond to the needs of pets found at the scene of an emergency.
As a firefighter, you're trained to respond to the needs of injured people. Some of those same skills can be used when responding to the needs of injured animals. By the end of this video, you'll be trained to perform basic assessment of an injured pet, provide artificial ventilation, provide cardiopulmonary resuscitation, evaluate the pet's response to your efforts, and do all of the above safely. If it's known that an animal is on the scene of an emergency, it's a good idea to notify local city or county animal service agencies. They can take custody of the animal once your assistance is finished and relieve you to do other things. You must decide quickly if the benefit of your intervention outweighs stress on the animal or puts your safety at jeopardy. We all know your safety must come first. Before we get started, I'd like to introduce our team. This is Hewitt, and this is Spot, and they're going to help us today demonstrate a few key points in our training video. It's common knowledge that a fearful animal will bite, but this is also a risk when dealing with an injured animal. Frightened animals can also use their nails and claws to try and escape, and you can't imagine the power in the back legs of a cat when it fears for its life. We're going to use Spot today to demonstrate some appropriate positioning issues. As you can see, he's got some confined space issues where we store him. Most people approach an injured pet in this direction, but that's not appropriate for your safety or for theirs. You're better to approach them from their back with their legs away from you and their mouth and head away from you. Remember to use your gloves to keep your hands safe, and you can try using your turnout jacket to confine them, or you can grab a drapery or a bedspread or even a rug to wrap them and keep them safe. Remember, don't wrap too tight. If the pet is really fighting your intervention, it may not really need your help. Remember, if you're bitten, report it immediately and seek medical attention. Cat bites can be especially dangerous. To avoid being bitten, a muzzle can be made out of a leash, a belt, or even a drapery cord. Now let's talk about anatomy. Most of you are familiar with the common anatomical terms, such as the oral cavity, the thorax, the abdomen, the limbs. Let me show you where the heart is positioned in a dog. If you bring the elbow across the midline of the thorax, the heart lies right underneath that. Now there's some orientation differences in pets versus people. This is dorsal, this is ventral, this is lateral on the outside of the limb, and medial on the inside of the limb. The first thing you want to assess is if the pet is breathing. Look and feel for chest movement, feel for air movement from the mouth and nose, or use a stethoscope to listen to the lungs. If you're concerned about an obstructed airway, carefully try to look in the mouth. If you suspect an obstruction, then there are 3 ways you can try to relieve it. If you're confident you won't get bitten, then you can first try to swipe your finger through the back of the mouth. Go for it. You can also try inverting the pet and giving a firm pat on the back. A third option is a Heimlich-type maneuver, with the animal's back placed against your chest and give an upward movement with your hands. Once you're comfortable the airway is clear, next you want to check for a pulse. There are 4 main locations to check for a pulse: the femoral artery on the medial side of the upper thigh, the carotid artery, which lies along the neck, the lingual artery, which is under the tongue. Be careful if the pet's awake. And by placing your hand over the heart, which usually is most effective in the smaller animals. In addition to checking for respiration and a pulse, you can check the pet's mucous membrane color, position of its eyes, and do a cursory look for any obvious trauma. If respiratory support is needed, start by placing the pet in lateral recumbence, with the legs pointing away from you. Extend the neck and carefully pull out the tongue to be sure the airway stays open. The facial anatomy of animals can be very different than that of people. There are notable size differences, and many have long lips that have to be dealt with. To provide ventilation, you'll need a set of specially designed masks. We will show you where you can get a set at the end of the video. From the 3 sizes available, select the one that will achieve a good seal for the size and shape of the pet's face. For a complete seal, you must be sure the entire oral cavity, lips and all, are contained within the mask. The next step is to connect the ambu bag securely and begin manual ventilations, which can be very effective at reviving an apneic pet. Give 1 breath every 5 seconds, or 12 breaths each minute. You should see moderate thoracic movements. Be careful not to overinflate the lungs of very small pets. There's tubing with which you can connect to portable oxygen if it's available. This can be helpful with animals that are breathing on their own but are in need of assistance. The flow rates are based on the size of the pet. Giant and large breed dogs at the adult human flow rate, medium dogs at the child flow rate, and small dogs and cats at the infant flow rate. It's very important to monitor the response to your intervention. So after a few minutes, stop and check to see if the pet's breathing. Look for chest movement, check for condensation in the mask, or use your stethoscope to listen to the lungs. If you do not receive a positive response to your ventilatory efforts, then this is the time to begin CPR. Proper patient positioning is very important for this. Due to the anatomy of the pet, be sure it is in right lateral recumbence. Locate the position where the elbow crosses the chest along the midline of the rib cage. Remember, this is where the heart is. Due to the shape of a pet's thorax, you cannot use both hands together. To be effective, you must place one hand underneath the heart and one hand over the heart and compress your upper hand into your lower hand. Give 15 chest compressions followed by 2 breaths. Then give 3 compressions every 3 seconds. The depth of your compressions should be approximately 1.5 inch for large pets, 1 inch for medium pets, and 1/2 inch for small pets. Be as careful as you can not to break any ribs. After a few minutes of effort, reassess the pet by checking for breathing and checking for a pulse. We've demonstrated for you today how to perform a basic assessment of an injured pet, provide ventilatory support and CPR, and how to monitor your intervention. Remember, your safety always comes first, but when you're successful at saving an injured pet, the people you serve will be forever grateful.
To learn more about the complete resuscitation kit shown in our video, go to firefighterssavepets.com. And thank you for everything you do to serve the people of your community.